An analysis of the American Health Care Act and what it means for Arizona.
I really don't think Don't Get Sick is a great health insurance plan.
A look at the numbers and the finances of healthcare.
If people have health insurance, they are healthier. But at the same time, it increases costs.
How healthcare policy shapes the state. This is Arizona Week. Hello, and thanks for joining us. In just a matter of days, we're expected to learn more about the costs of the American Health Care Act. That's the Republican plan to repeal and replace the Affordable Care Act. The bill passed the House and is in the hands of the Senate. The Congressional Budget Office is expected to release a cost analysis sometime in the coming days. Here's a look at some of the numbers in Arizona. In 2012, before the Affordable Care Act, 3.3 million people, that's about half the state's population, had insurance sponsored by their employer. More than 1 million people and children received services through Medicaid. About 12% had Medicare benefits, and the uninsured made up about 18%. 4 years later, 2016, after the Affordable Care Act took effect, nearly 3 million people, about 41% of the state's population, had insurance through their employer. Nearly 2 million people, including children, were covered by Medicaid. About 950,000 had Medicare. The uninsured had fallen to about 770,000. That's about 11% of the state's population. Individuals purchasing insurance on the federal marketplace made up 4% of the state's population. These numbers provided to us by Dr. Daniel Dirksen at the University of Arizona Center for Rural Health. Dirksen says if the American Health Care Act takes effect, 380,000 Arizonans will lose health coverage, a federal price tag of about $2.5 billion over the next 10 years, a cost the state would have to cover. The American Health Care Act, Dr. Dirksen says, would have a devastating impact on Arizona.
Yeah, Arizona's made remarkable progress in the last 5 years since some of these provisions went into place that expanded coverage. Since 2014, we've almost halved our uninsured in Arizona. And there's a correlation, a very strong correlation, with the reduction in uncompensated and charity care that hospitals had to absorb. Their fiscal margins have improved over the last couple of years to where even our rural and critical access hospitals, the smallest hospitals, the ones that are really in the areas that need them the most, have really seen an improvement, a healthier bottom line.
From what I've read, the analysis indicate that this could do something to it. People are certainly kicked off the program with the American Affordable Care Act, but they also reduce some financial burdens that we have had in the U.S. Does any of that make this right?
I don't think there's enough positive in the current version, at least the one that made it through the House in the American Health Care Act. Again, the most concerning thing to those of us that follow these is that it would remove $880 billion over the next 10 years from state Medicaid programs. That's a substantial cut. States really can't make up that difference by increased autonomy or freedom to pick and choose what they want to include in a benefit package. What that really means is that 400,000, for example, Arizonans lose coverage. And what it means is that the hospitals have to take on more uncompensated and charity care as those people become uninsured. The Medicaid changes alone are devastating. It's almost $1 trillion over 10 years just in the Medicaid cuts. And from my view, what it looks like they're doing is, in Congress, is trying to create cost savings, almost $1 trillion over 10 years, to create this tax cut. And that tax cut would benefit a small percentage of the population, while it would throw 14 million Americans off of Medicaid coverage and another 10 million individuals who are currently covered through the marketplace coverage that gets more attention than anything else that would become uninsured.
You're a physician, so what happens if one of those 400,000 patients, Medicaid patients in Arizona, suddenly no longer has access to health care?
So we see much poorer health outcomes when people don't have health insurance. And we see the stress really shifted in those costs from state or federal coverage to hospitals and clinics, physicians and nurses having to absorb those costs as part of their mission to take care of people regardless of their ability to pay.
Has there been the same effect on people who face higher deductibles, higher premiums now as a result of the Affordable Care Act?
just to take a step back, over the last 10 years, we've seen most of the health insurance in our country is through employer-sponsored insurance. That's how I get my insurance, probably how you get your insurance. And what we've seen over the last 10 years, even before the Affordable Care Act, was more and more of the costs of paying for those premiums and the out-of-pocket expenses through co-pays and deductibles was being shifted from the employer covering those costs to the employee having to pay for those costs. So in employer-sponsored insurance, we've seen this trend that far preceded the Affordable Care Act. What the Affordable Care Act did is it stabilized it for low-income individuals, those less than 133% of the federal poverty level. It gave them options to obtain Medicaid coverage if their state offered Medicaid expansion. Our state did in Arizona and made a conscious decision in 2014 to start that. Other states did not. It also helped individuals get some market clout to buy a plan and get some of the costs of paying that premium subsidized. So with the American Health Care Act, the bill that made it through the House, and the Senate is going to work their own version of a bill, really removes most of the subsidies to make that affordable.
The cost is part of the healthcare equation. I mean, we like to think that healthcare is strictly caring for people in need, but there's a financial component that makes this very real.
Before the Affordable Care Act, and then in the years, it was passed in 2010, the coverage provisions really kicked in 2014, so there was a bit of a delay there. In the years between 2010 and 2016, we saw the lowest rate of growth in costs that we'd seen in the 50-year history since we started measuring that particular metric. So we had really started to stabilize costs and really had started to make it more affordable for people by helping subsidize people's payment so they could get coverage. My contention as a family physician and as a person who pays attention to health policy issues, you don't save costs by not covering people with health insurance. You just shift those costs from one ledger sheet, in this case maybe the federal government's ledger sheet, to the tune of $1 trillion over 10 years in the case of the Medicaid cuts that are proposed, and you shift those costs to a safety net hospital or a physician or a nurse who's willing to take care of people even if they can't afford to pay for it. And you have to write those off. The more rational way to do this, the more humane way to do it, the way that actually saves costs, is to get people covered and to make sure that you institute those interventions that help control cost growth. So you don't save money by not treating a person with diabetes. You end up spending more money because they have to go to the hospital to get things that could have been prevented. So you want to make their medications that help control their diabetes more affordable. You want to make the medications that help people get their blood pressure back in the normal range if they're hypertensive. If you focused on those 4 or 5 issues that really drive costs, you could really control cost growth for that population by not making insurance affordable, by not making pharmaceuticals affordable and drugs affordable, by not getting people ready access to primary and preventive care, and then if they need it, the full array of specialty services. All you're doing is you might be decreasing the costs over here, but the costs over here increase. What we have to do is a much more systematic approach.
There are nearly 7 million people in Arizona. About 20% of the population receives Medicaid and kids care. Governor Doug Ducey says he's monitoring health care discussions closely. Last week, he spoke with Arizona Public Media.
Well, let me clarify. I am a fan of repealing Obamacare. So that I want to do. I think the skill is in the replacement. And what I offered on the first bill that was coming out of the House of Representatives were the facts on how it would affect the state of Arizona. As governor, I want to advocate for the best possible policy for our citizens, and I've said I don't want to see any citizen have the rug pulled out from underneath them. So the bill that passed the House this time will be completely different as it comes out of the Senate. Just know that the governor's office will be in communication with our United States senators. We'll be offering our resources from our Medicaid department to our healthcare advisor, working with John McCain and Jeff Flake, so that when we repeal Obamacare, we're replacing it with something that will expand the insurance market in the state of Arizona, offer more options to our citizens, not pull the rug out from underneath anyone, and give maximum flexibility to governors to address this issue, because it's different in every state.
At Arizona State University, a professor recently co-authored a book titled Rescuing Healthcare, a leadership prescription to make healthcare what we all want it to be. Here's a portion of that interview from our sister station, KAET, in Phoenix.
Leadership comes in to make that happen. The key to helping correct the delivery of healthcare. I'm not talking about solving an insurance problem. Politicians are still struggling to do anything just about insurance. We have a lot of people with insurance that aren't getting the best care, the best coordination, the best outcomes. So insurance all by itself does not solve the problem. That's one piece. And politicians, as you alluded to just before, they sort of accomplish the possible. Leaders have to accomplish what seems to be impossible. There's a difference between a leader and a politician. And leaders have to look at, here's the future, and here's where we are. How do we get there from here? And the first role, particularly for healthcare, is if we can get the key leaders, and I'm not talking about just one group. There are many, many people that have to have a shared vision of just what you said. What are we trying to aim for? And once you can create that shared vision, the next level of leadership, role for leadership, is to get people to understand, if this is where we want to be, here's where we are. There's a gap.
The American Health Care Act passed the House and it's in the hands of the Senate. Every House Democrat voted against the AHCA. Representative Raul Grijalva says the proposal takes healthcare in the wrong direction.
I think that the American people, they might not be enamored with Obamacare as a majority, but they understand that this is a lifeline, and they're supporting it. We have to take it steps further as we go forward, and that's what I meant. The Democrats have a responsibility to talk about how we're going to make this better, not just stay status quo. I think the Senate politically, difference between senators and representatives, we run in districts, they run in states. And for some senators, particularly Republicans, 8 or 9 of them, the jeopardy of moving forward with the House version is politically untenable for them. They would lose their election. So I see them dragging it out for months and then coming up with something that looks remarkably like Obamacare and saying that that's their repeal. I don't see them accepting what the House did.
Are there parts of the current Affordable Care Act that you say should go?
If we're not going to move in the direction of single payer, which I think in the long term we have to in this country, I think we need to present a public option which makes Medicare for all and put that into the marketplace so that it creates a marketplace that's competitive. Right now, insurance companies can, among themselves, decide that we're only going to show one provider that controls that marketplace and can decide what the costs are going to be. I think having a public option gives people an alternative to say, I'm going to go to this one. And I think that'll lower all the costs all the way down. I think that's one thing right away we can do. I think we need to look at reimbursements in Medicare and Medicaid and bring them up to a level where physicians and providers feel that they're getting a fair share. And I think we can buy pharmaceuticals in bulk through Medicare and Medicaid, like the VA does, and drop the cost by 40 or 50% for the consumer. Those are 3 simple things that strengthen it. I would, and I think at some point you have to talk about capping premiums and deductibles. The insurance companies won that debate with Obamacare. That's one I would revisit, just so we can have, at the very minimum, the instructional opportunity to have a debate so the American people could see what that means to them.
Republican Congresswoman Martha McSally voted for the American Health Care Act, saying that while it's flawed, it's better than what she called the failures of the Affordable Care Act. Arizona Public Media made several requests to Congresswoman Martha McSally for comment. We received no response. The Republican-led plan to repeal and replace the Affordable Care Act takes American health care backwards. That's what Andy Slavitt said. Slavitt is the former acting administrator for the Centers for Medicare and Medicaid Services under the Obama administration. He's now a senior advisor to the Bipartisan Policy Center. Last week, he visited Tucson and spoke with Arizona Public Media's Christopher Conover.
First of all, thank you so much for sitting down with us. We've seen the House repeal the Affordable Care Act. It's now in the Senate. We'll see what the Senate does. But if nothing changed, what does all this mean for Arizona?
So I think it means a number of things. I think for the citizens of Arizona, the residents here, there's hundreds of thousands of people that have benefited from Medicaid expansion that if this bill were to pass the Senate would lose coverage. The Medicaid program itself would be cut by 25%. Now remember, half the people in the Medicaid program are kids. The biggest portion of the Medicaid program goes to care for people with disabilities, and Medicaid funds half of the nursing home care. So in this state, that's an enormous hit, let alone a budget hit for the state.
We've heard Democrats, even from Arizona, Representative Sinema from Phoenix, say that the Affordable Care Act as it was not necessarily working for Arizona. A lot of counties had only one provider. Something had to be done, correct?
Well, if that's what we were talking about, if we were talking about both sides coming together to work on solutions, to increase competition, to improve affordability, I think we'd be having a different conversation. What we really are having, though, is a bill that cuts $1.2 trillion from Medicaid and from subsidies that people get, and takes that money and targets an income, a tax cut to high-income earners, to insurance companies, to pharmaceutical companies, and to tanning salons. So that has nothing to do with fixing competition in the exchange, which that's what we were focused on. If we were saying, let's look at the 30% of the ACA that we can make better, or the 40% or the 50%, depending on where you live, and Phoenix has had more challenges, we would be coming up with solutions that I think are well within our grasp. That's not what we're doing here. What we're doing here instead is considering a bill that cuts care for millions of people.
With your expertise and background on this, for a state like Arizona, what would be a fix to get the Affordable Care Act fixed, or something to follow on in its place?
First of all, take Medicaid off the table entirely. It's working very well in the state. It's covering a lot of people. It doesn't need to be touched. Then focus on how we get more competition in the exchanges. And I would do what another state's done, what Alaska's done and what Minnesota has done, which is they've funded a reinsurance pool. And that reinsurance pool attracts more health plans to the market. It attracts them to the market because it says if someone has $1 million claim, that will get shared rather than put in one company. And when that happens, you'll see people enter the market. And in the case of Alaska, they had rate increases that were well into the double digits, 40, 50%, that were reduced to single digits once they added this reinsurance pool. So I consider these things surgical rather than a rebuild.
Funding a reinsurance pool, the state, how much does that cost? State dollars are always tight, budgets are always...
State budgets are always tight. And the good news is it doesn't all have to come from the state budget. In these other states, some of it was funded through a provider tax because providers have some benefit to obviously continuing not to have people show up at their door and not be able to afford to pay. And the other good news is the federal government, through something called a 1332 waiver, also funds a slug of it. So, there's lots of questions. How big does it need to be? How much can be afforded and so forth? But it's been a very good deal for both the state, the federal government, and the residents.
What do you see as the future? The House has passed this repeal. That's not necessarily new. The House has tried to pass repeals before. Things get hung up in the Senate. What does the future look like for this bill in the Senate?
Well, here's the good news, and I think it's particularly interesting news in Arizona. There's a 52-48 majority for the Republicans in the House, in the Senate, I should say. There's no Democrat that's going to vote for a bill that takes coverage away. I think there's Democrats who get on board with something that was more constructive. But that means that the Republicans can only afford to lose 3 votes. And there's 1 or 2 that are probably already spoken for. So if Senator Flake or Senator McCain were to come out publicly and say, I'm not going to support a bill that takes all this money out of our state. I'm not going to support a bill that that impacts Medicaid and Medicaid expansion here in Arizona, they would be able to dramatically influence the dialogue. The margins are that close that all it would take is one person coming out early. Now, if they don't, then I think you end up at a stage where you get towards the end and it's easy to strong arm people to get on board because you've done all that work. But encouraging the senators who really have the most at stake, like they do here in Arizona, to come out early and say what they won't support is very important.
The cost of healthcare plays a role in our state's economics. Dr. Keith Joyner is a professor of medicine and economics at the University of Arizona.
Health insurance is to some extent a double-edged sword. It certainly is clear both from evidence before the Affordable Care Act and now some very interesting evidence afterwards that if people have health insurance, they are healthier. But at the same time, it increases costs, both for the individuals and for public insurers such as Medicare and Medicaid. It increases costs there. So it's a balance. One has to strike the balance between having insurance, which does improve health, and trying to make sure that insurance is not too costly for individuals to afford.
The American Health Care Act that we have just recently seen, there are some tax credits, there's deductions. How does all that sort of phase out when it comes to the American taxpayer, to the person who's receiving health insurance?
Well, I think the best way to think about the American Health Care Act, or at least one way to think about it, is to think about it relative to the Affordable Care Act. The primary purpose of the Affordable Care Act was to expand the number of people with insurance. And it did so through a number of mechanisms, but by far the 2 major ones were expanding the number of individuals who were eligible for Medicaid, and then also creating these healthcare exchanges or healthcare marketplaces that provided a mechanism for self-employed individuals or individuals working for small businesses to get insurance. And the American Health Care Act is changing both of those by altering the way that they will be paid for and altering, in particular with Medicaid, the opportunity to expand the number of people who have Medicaid in which the federal government will help cover the costs.
Is it too early to say that the American Health Care Act versus the Affordable Care Act, one is more economically viable for Arizona?
Arizona is one of those states that expanded Medicaid under the Affordable Care Act. And those are the states, and there's about 30 of them now, I believe, that are going to be most impacted by the American Health Care Act. The expansion of Medicaid was financed almost exclusively by the federal government. And what's going to happen in 2020 is that the amount of money that the federal government will allocate to states for Medicaid, and Medicaid is a federal-state combined program, is going to be capped. And therefore, for states like Arizona, which had expanded Medicaid and has a much larger Medicaid population that the federal government is largely financing at this point, will be more challenged to cover those individuals than they are now. And not only will the individuals be challenged, but the hospitals will be challenged and the providers will be challenged. And that, I would think, is probably the biggest impact that Arizona particularly will face as a consequence of the American Health Care Act.
So the cost shifts from the feds to the state.
Right. And the states will have the option of whether they want to keep funding the individuals who have been previously enrolled in Medicaid through the ACA. But the bigger problem is that it will not be possible to expand the number of Medicaid enrollees based on federal government funding. The federal government funding is going to be capped, basically.
And if we have 400,000 people in Arizona who suddenly went on the Affordable Care Act when it came to fruition, if they get kicked off or off the program with the American Health Care Act, does that have a ripple down effect throughout the economy in Arizona?
Oh, absolutely, absolutely. And there's estimation, there are projections both nationally and locally as to what impact it will have on employment, what impact it will have for hospitals. Hospitals are particularly vulnerable to this because Medicaid is certainly a source of many of the patients there, and as the Medicaid funding gets cut, it becomes more and more difficult for the hospitals to cover the costs of those individuals when they require hospitalization.
As people watch this unfold, because I do think people are more interested than they've ever been before, but what ought they be looking for during this process? As it's gone through the House, it goes to the Senate now, and it could change dramatically.
That one of the major consequences in health insurance more generally is that the out-of-pocket expenses for consumers are increasing at an extremely rapid rate. Healthcare deductibles are now going up. It's very common now for employers to only offer healthcare plans to their employees that have high deductible health plans. Some of the deductibles can be $5,000, $6,000, $7,000, $8,000, which has basically made health insurance almost useless for many people who have it. And I think that combined with rising drug costs, the things that consumers are really concerned about are the high deductibles and the rising drug costs. And premiums to some extent, but not so much really as these out-of-pocket expenses that they have. And that's what people should try to keep an eye on, recognizing that trying to figure it out and connect the dots is difficult for even people who are in the field.
The higher deductibles, the higher premiums, is that a result of the Affordable Care Act?
Not really. The high deductible health plans, which were relatively uncommon in the early 2000s, have been increasing as a percentage of all the health plans that are offered, and that increase started well before the Affordable Care Act. So as opposed to 5 or 6% of all health plans being high deductible plans back in 2004, by 2010 it was up to almost, I can't remember the exact number, but it was probably about 20%. And now we're up in the 30% range. So this trend of moving to high deductible plans to actually shift out-of-pocket expenses to the consumer started well before the Affordable Care Act.
And that's our program. On next week's program, Arizona Public Media's Nancy Montoya reports on the number of senior citizens applying for U.S. citizenship. Plus a story of graduating triplets in Tucson who hope their parents can cross the border for the ceremony. For all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.